Well, the first surgery in May of 2013, I had an incident where my lower back was in extreme pain and it was going down my left leg. In August of 2013, I went back to see my primary care physician because my left foot was not functioning, and they sent me to see Dr. Mathers. For my second surgery, I actually was having increasing pain in my lower back, and then I ended up having to go by ambulance to the ER, and he performed surgery the next day. And then my third surgery, increasing pain again in my back, and we knew that it was time for the big surgery.
I saw Ms. Carnell. She came to me with low back and terrible left leg pain in 2013. She had an MRI that showed she had a very large disc herniation that was compressing against her sciatic nerve. Eventually we went on, after she failed conservative treatment, to doing a microdiscectomy, and that was done as an outpatient basis. Nicole did great for 2 years, but then she called me saying that her leg was hurting again. We got another MRI and it showed that she had a recurrent disc herniation. Looking at her MRI and at her age, I decided that we would just go back in and remove that disc that had reherniated. She was in terrible pain, so we admitted her to the hospital and we did that surgery the next day. She did really well. After surgery, her leg pain got much better, but then over time, she started having a lot of back pain. Her disc that had herniated twice had degenerated, and at this point, we had to go back and do a fusion.
Before my third surgery, it was a lot of mental. I had the physical pain, but I was getting depressed because I'd been in pain for so long, and I was afraid to do anything because I was afraid I would end up in the ER again, and that was the last place I wanted to be.
And we decided that we would do a minimally invasive fusion where through a tube we could go down, take the disc out using a microscope, look directly at the disc, put a spacer in there, and then in the back, through small incisions, put the screws that would aid in the fusion.
Before the third surgery, we had our patient-doctor relationship pretty well figured out at that point. And he was so good because he talked with me instead of at me, and together, even though we knew I was going to have fusion, we figured out how many fusions I was going to need. It took a long time. It took a lot of talking and conversations, but he was very patient, very straightforward, and very comforting. I can't say enough. Nobody wants to have surgery, but to have people around you that are compassionate, that understand what you're going through. They make you laugh when you need to laugh. They cry with you when you need to cry. From everybody with the surgery to everybody here in the office, I can't say enough good things about them. And nobody else is going to touch my spine but Dr. Mathers.